Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, has a relatively new category called Obsessive-Compulsive and Related Disorders, or better known as OCD, which were previously organized in different sections. This category includes a number of disorders like body dysmorphic disorder, hoarding disorder, trichotillomania, or hair-pulling disorder, excoriation, or skin-picking disorder, substance or medical-induced, obsessive-compulsive and related disorder, obsessive-compulsive and related disorder due to another medical conditions, other specified obsessive-compulsive and related disorder, and lastly, unspecified obsessive-compulsive and related disorder. What is obsessive-compulsive disorders? According to DSM-5, it is characterized by the presence of obsessions and compulsions. Other obsessive-compulsive disorders are recurrent, body-focused, repetitive behaviors as well as repeated attempts to decrease or stop the behavior. It has a close relationship to anxiety disorders. Diagnostic criteria are presence of obsession, like recurrent and persistent thoughts or urges and attempts to ignore or surpass them, and compulsions. Repetitive behaviors or mental acts the individual feels driven to perform in response to obsession and preventing or reducing distress, dreaded event or situation. Both can take more than 1 hour per day. The age of onset is 19.5 years and starts by 14 years, usually chronic. Males has earlier onset than females and reports show suicidal thoughts and attempts occurs. There is a 12-month prevalence of OCD in United States and is 1.2% with a similar prevalence internationally, which is 1.1% to 1.8%. During childhood, males are more commonly affected, while in adulthood, females are affected at a slightly higher than males. The treatment for OCD are cognitive behavioral therapy, or known as CBT, and in medications, specifically antidepressants. What is body dysmorphic disorder, or BDD? It is the preoccupation with perceived defects or flaws in physical appearance, which is not observable or appears slight on others, and by repetitive behaviors or mental acts in response to appearance concerns. Here are the diagnostic criteria. At times, the individual performs repetitive behaviors such as mirror checking, excessive grooming, and reassurance seeking. Also performs mental acts like comparing appearance to others. But appearance preoccupation isn't concerned with body fat or weight, which meeting the diagnostic criteria of eating disorder. The age of onset is 12 to 13 years old, which is usually chronic. The prevalence is that people who have BDD has a high rate of suicidal ideation and attempts on adults and children or adolescents. Among adults in United States is 2.4%, consisting 2.5% in females and 2.2% in males, and 1.7% to 1.8% outside the United States. Treatment for BDD are cognitive behavioral therapy and selective serotonin reuptake inhibitors, or SSRIs, are considered the first line of treatment for BDD. What is hoarding disorder? It is the difficulty discarding or parting with possessions regardless of their value. The diagnostic criteria for hoarding disorder is perceived need to save the items and to distress associated with discarding them. Difficulty in discarding possessions results in the accumulation of possessions that congest and clutter active living areas and substantially. The age of onset, symptoms first emerges around ages 11 to 15 years old, starts to interfere individuals functioning by mid-20s, and causes impairment by mid-30s. Course of hoarding is chronic. The prevalence is that hoarding has a significantly prevalence rate among males, more prevalent with adults aging 55 to 94 years old. The treatment for hoarding disorder is cognitive behavioral therapy, or known as CBT. Is trichotillomania, or hair-pulling disorder. It is a body-focused repetitive behavior which involves pulling out one's hair. Hair pulling may occur in any region of the body in which hair grows, but the most common sites are the scalp, eyebrows, and eyelids. Diagnostic criteria is pulling their own or someone's hair repeatedly might end up in hair loss. Causes significant distress or impairments in social, occupational, or other areas of functioning. Age of onset is teenage years and is during puberty. Prevalence is in the general population within the 12-month prevalent estimation 1 to 2% of the population have trichotillomania. Females are more prevalent than males in the ratio of 10:1. The treatment for hair pulling disorder has no medication for this. Available therapies are habit reversal training, cognitive therapy, and acceptance and commitment therapy. What is excoriation or skin picking disorder? It is characterized by the repetitive picking of one's own skin. The diagnostic criteria is pulling their own skin repeatedly might end up skin lesions. Trichotillomania or hair pulling disorder is the same as skin picking, which causes significant distress or impairments on social, occupational, or other areas of functioning. The age of onset is present in various ages, most often during adolescence or puberty. Dermatological conditions such as acne. The prevalence, in the lifetime prevalence, individuals with excoriation have the prevalence of 1.4%. It is commonly in adult females. The treatment for this is the therapy medications that includes habit reversal training and stimulus control therapy. Stimulus control. What is substance or medical-induced obsessive-compulsive and related disorder? The criteria are obsessions, compulsions, skin picking, hair pulling, repetitive behaviors, and other symptoms. The age of onset is that the symptoms are developed during or soon after substance intoxication or withdrawal or exposure to a medication. The prevalence is that in the whole population, very rare, indicating individuals with some substance or medical-induced obsessive-compulsive and related disorder. The treatments are antidepressants and forbidding prescription of medicine. Obsessive-compulsive and related disorder due to another medical conditions. The diagnostic criteria is typical features are noticeable in the clinical picture like hoarding, skin picking, compulsions, obsessions, hair pulling, and preoccupations with appearance. Medical conditions must be from the indication of the physical examination, history, and laboratory findings. It is caused by clinically significant distress, impairment in social, and other important areas of functioning. The diagnostic features are Sydenham's chorea, pediatric autoimmune neuropsychiatric disorder, and cerebral infarction. Differential diagnoses are delirium, mixed presentation of symptoms, substance medication-induced obsessive-compulsive and related disorder, obsessive-compulsive and related disorder, illness anxiety disorder, associated feature of another mental disorder, and other specified obsessive-compulsive and related disorder or unspecified obsessive-compulsive and related disorder. Other specified obsessive-compulsive and related disorder. The other OCD-related disorder classifications are used in happenings where the clinician chooses to communicate a specific reason that appearance does not conform to criteria for any specific obsessive-compulsive and related disorder. The other specified designations, body dysmorphic-like disorder with actual flaws, has defects or flaws in physical appearance. The treatment is cognitive behavioral therapy and antidepressant medications. The body dysmorphic-like disorder without repetitive behaviors, an individual has not performed any repetitive behaviors in response to the appearance concerns. The treatment is cognitive behavioral therapy and reduced stress and try mindfulness meditation. Lastly, the body-focused repetitive behavior disorder, recurring body-focused repetitive behaviors like nail biting, lip biting, and cheek chewing. The treatment is antidepressant medications. Obsessional jealousy. Preoccupations may result to repetitive behaviors in response to the infidelity concerns. The treatment is cognitive behavioral therapy and cognitive analytic therapy. Shubokyofu, the excessive fear of having bodily deformity. The treatment is morita therapy and serotonin norepinephrine reuptake inhibitor. And the koro, the episode of sudden intense anxiety that the penis will recede into the body. The treatment is psychotherapy. And lastly, the jikoshu kyofu, the fear of having an offensive body odor. The treatment is cognitive behavioral therapy. Unspecified obsessive-compulsive and related disorder. In this division, the unspecified obsessive-compulsive and related disorder are used in happenings where the clinician chooses not to specify the reason that the criteria are not met for a specific obsessive-compulsive and related disorder. Considers performances in which there is inadequate information to make a more specific diagnosis.